Chairman Sanders, Ranking Member Enzi, and distinguished members of the subcommittee. My name is Tess Kinning, and I am the Executive Director of Bi-State Primary Care Association located in Montpelier, Vermont, and Concord, New Hampshire. And on behalf of the entire health center community, including more than 22 million patients nationwide and the National Association of Community Health Centers, I want to thank you for the opportunity to testify on the role of community health centers in addressing our nation's pressing primary care access needs. As the committee is aware, two important events have significantly altered the healthcare financing and delivery systems of our nation: the Patient Protection and Affordable Care Act and the Supreme Court's decision about the same. As a result of these events, it is estimated that as many as 30 million Americans will gain coverage through Medicaid and/or the health insurance exchange. Yet another 30 million will still remain uninsured. We strongly support these coverage expansions, which open the door to a broader healthcare system for many of our patients. However, we know well that coverage alone does not equate to access. It is access to regular care that makes coverage meaningful. We also believe to achieve a truly reformed health system, our nation needs sustainable solutions to increase our primary care capacity, lower and manage our healthcare costs, and assure quality outcomes. It is for this reason, in my view, that any efforts to increase access to insurance must grow and expand our primary care infrastructure. Community health centers offer a unique and proven solution to these challenges. By statute and mission, community health centers are located in medically underserved areas and serve medically underserved populations and care for everyone regardless of your ability to pay. Community health centers also are directed by patient-majority boards, ensuring care is locally controlled and responsive to each individual's community's needs. It might surprise you to learn that the Community Health Center of Burlington in Burlington, Vermont, provides translation for patients from the Sudan, Bosnia, Somalia, Burundi, Tibet, Nepal, Bhutan, and Burma, to name only a few. The ability to receive care in one's native language removes a major access barrier and improves the health of these families and our communities. From my years of clinical practice as a nurse in Nepal, I am able to speak Nepali with our increasing immigrant and refugee population from Nepal and Bhutan, and I see firsthand the benefits that this type of enhanced provider-patient relationship can yield. Without access to primary care, many people, including these families, might delay seeking treatment until they are seriously ill and require hospitalization or care in the emergency room at a much higher cost to themselves and to the healthcare system. The literature backs up these real-world experiences. For example, the Journal of Rural Health article found that counties with a community health center had 25% fewer emergency room visits. Other data demonstrate the community health center saved the entire health system, including government and taxpayers, approximately $24 billion annually by keeping patients out of these costlier healthcare settings. Unfortunately, Congress, with the leadership of this Fortunately, Congress, with the leadership of the subcommittee's chair, had the foresight to include mandatory funding to expand the reach of the nation's community health centers in the Affordable Care Act to ensure that the promise of coverage was met with the reality of care. We believe that seeing this plan through is essential. Unfortunately, the community health center expansion is not currently on track. A recent HRSA solicitation for no access point grants anticipates spending only $20 million of the $300 million in new fiscal year funding, fiscal 13. The administration has instead proposed spreading out the community health center growth over a much longer period of time, and we urge that the full Affordable Care Act provided increase for fiscal year 13 be immediately extended to care for 2.5 million new patients, as Congress intended. The demand for community health centers continues to outpace the growth, and more than 60 million Americans still lack access to primary care. In Vermont and New Hampshire, in the near term, all of our 19 health centers have identified needs in their areas. I would be remiss if I failed to cite another vital program that supports the goal of creating medical homes for underserved Americans, and that's the National Health Service Corps. The Corps places trained health professions in health shortage areas and remains a key partner in ensuring that community health centers can meet the demand for primary care that is looming just around the corner with the ACA implementation. Community health centers around the country are ready, they're willing, they're able to be leaders in reforming our health system, community by community, from the ground up. We appreciate your leadership and look forward to your and the committee's continued support as we work to provide meaningful health care access to all. Thank you, Mr. Chairman.